Welcome back, welcome back, welcome back. This is Shirley Crawford, your host of the WorkHARDAholic Show and the original WorkHARDaholic. And today, welcome to the WorkHARDAholic Show with your host, the original WorkHARDaholic, Shirley Crawford, author, speaker, and small business consultant for over 20 years, helping you to work hard, play harder, and business better. If you see this very handsome gentleman to my left, I have with me Tracy Causey, who is the director. Do you go by executive director?
Actually, chief executive director.
Oops,
chief executive officer, I'm sorry.
You can tell I spend too much time with you nonprofit people. Nonprofits have executives, directors. But this conglomerate over here, we're going to go for the CEO of Capital Area Health Network.
That's correct.
Okay, so for those of you who have seen their locations throughout Richmond and in other locations as well, actually,
Yes.
You've seen them around and you're going, okay, what are they? How do they exist? Hold on, we're going to get to that. But before we get there, let's see the man, the myth, the legend behind our local con network. Tracy, welcome.
Thank you so much, Shirley, and it's a pleasure to be here. It's taken me a long time to get here, but I am finally here.
I wasn't going to say it, but it's true. We're glad you finally made it, and we know it's going to be totally worth it. But talking about finally making it, you are not a native Richmonder.
No, I am not. I am a transplant from Mississippi.
We might as well claim you now. You've been here long enough.
Been here 20 years now.
Yeah, we're going to claim you.
The family now.
You're in there. But what was the path that got you from Mississippi here?
Well, it started many, many years ago. I was a baby, and then I grew up.
That was part of the journey.
That was part of the journey.
Let's fast forward just a little bit.
Fast forward a little bit. And so I think my love for people got me here, really. And the course or the direction that I took, of course, began in high school when I was trying to help people in high school and doing my little chores around the house. I worked on a farm and I delivered calves. I put up fence. I've done it all a little bit in my background.
You're not scared of any of these people
I'm not afraid of too much
okay,
anything.
that
That's
explains
right.
it.
But I'm very happy to say that my parents are my foundation. And so the hard work that I see that they are doing or did when I was growing up really motivated me that I have to work just as hard because they instilled that in me. And work for me, it is a chore. However, doing the right kind of work, it's not really work, and I'm very blessed that I think I'm doing the right kind of work or the right work that I was intended to do. So
when you do what you love, it makes all the difference in the world.
It certainly does. It's not really work. It's hard, but it's not really work. That's why I love the name of the show here.
WorkHARDaholics, because we love what we do.
That's right. That's right.
Was it the farm that led you to study biology?
I think so. Early on, I think I like animals, and I like the transitions of animals from growing from little babies all the way up through their adulthood, and seeing that. Of course, we used to kill our own calves for beef, and we used to kill our own hogs. So I've seen all of that, and then I think though that I thought in one of my lives I wanted to be a doctor. I wanted to help people in that way. I got to college. I went to the University of Mississippi, Ole Miss. And I joined the Air Force, ROTC. And it was in the Air Force ROTC where I began to get into leadership positions, administrative positions, that I was able to effect change rather quickly. And so that really stuck with me. And I said, you know what? I could be a doctor. I can save lives and those kind of things like that. But I want to be in a position where I can really help people navigate the system and get the type of care that they really, really need. And so in college, ROTC, the Air Force ROTC, the leadership opportunities that it afforded me got me to where I am right now.
And even in the midst of this, I was impressed because honestly, after going through school for a couple degrees, you went back and got a second master's degree.
I did. My first master's was in Master's of Science in Public Health. of course. I like policy. And so I think that what impressed me about that is that on my path to where I am now, I figured out that to really affect change, you have to write the policy, you have to write the laws, you have to make
Indeed.
you have to make sure that you can really chart a pathway for people to follow, and policy is where it is. And so I got my science, my master's of science in public health, and hopes of learning how to do that, which I did. And then I figured out that you know what, this is a business. And
Always,
so,
always. At the end of the day, it's always a
it's
business.
always a business. So I need to understand what those things about business is really about. So I decided to go back and get my master's of business administration, and here I am today, utilizing it.
That was no small journey.
No.
So then you did all the degrees. You left the cows behind. Okay. And so then how did you get involved with Con?
Well, one of my mentors used to be the commissioner of health here when they had commissioners of health for the Cedar Richmond Health Department.
What an insignificant mentor to have.
And actually, he was one of my professors at Meharry Medical College. And so I kind of latched on to him. I went to an internship in Florissant, Missouri for the Daughters of Charity. I worked for the Ascension Health, the nonprofit hospital system, and they had over 500 hospitals. And I think I really want to do something in this field here, in administration, in this field, hospitals and things like that. They put me in a section called strategic decision, and I loved it. I got a chance to do some maps. I got a chance to drill down to see where all of the health issues are and where the racial issues are and how it's impacting healthcare, the racial inequalities. And so that really stuck with me. And I was talking to my mentor one time, and he says, you know what? You will be ideal for a community health center. It's in the community. It is helping the people who look like you and I and beyond, not just look like who we look like, but everybody. And that intrigued me. That really intrigued me. So I did some research on it, and I found out that, yeah, he's absolutely right. People really need access to care. They need access to care. And even in this day and time, believe it or not very many people have the same level of access to care as everyone else does.
Oh, I believe it.
It's unbelievable in many conversations to still have that conversation that we are fighting and we're striving to be equal or trying to be equitable in our distribution of healthcare in this country. That is just amazing to me, but it exists. It really exists. And that's what brought me here. Dr. Ellis is his name. Dr. Ellis, who's the commissioner here.
Dr. Ellis.
Yes, thank you, Dr. Ellis. And he told me about this opportunity. He was on the board of Vernon J. Harris Health Center, and they had an opening. So he encouraged me to apply. I did. I'll be the first to tell people, I was not the first choice. I was not the first choice.
But you were the best choice.
But I was the best choice. Yes, I was. Because the first choice was found not to be not so good.
Well, we're going to say thank you to the committee that finally made that decision. And if you want to learn more, you hear the passion, you hear the purpose over here,
Yes.
you want to learn more about the outcome of what he has been able to produce at Con. Be back after this commercial break. Ladies, are you looking to move your office from your kitchen table to a space of your own? Are you ready to take your business to the next level? Are you looking for co-working and community? Well, then come join us at the Women's Business Center, RVA, located at 1510 Willow Lawn Drive, Suite 100, directly across the street from the Kroger at Willow Lawn. Visit us on the web at WBCRVA.com or on social media at WBCRVA. Hello, hello, hello. Shirley Crawford here, the original WorkHARDaholic and your host for the Diva Mastermind Retreat. This is going to be an exciting time to help you know your value, know your worth, to address the imposter syndrome, to also help you better understand your personal brand and your business brand. And all this is going to happen October 9th through the 14th in Duck, North Carolina. Want to know how you can participate? This is how. You can register. We can start off by visiting ShirleyECrawford.com. And then you can look for the link that says Diva Mastermind Retreat. Diva standing for doing it very authoritatively. We're not apologizing anymore. You are who you are. You are great, and you're meant for greatness. So come and join us October 9th through the 14th in Duck, North Carolina. If you have signed up for the Mastermind group, the retreat is free. Otherwise, you can register online, ShirleyECrawford.com. We'll see you there, divas. Welcome back, welcome back, welcome back. Okay, so if you were with us from the beginning, which why wouldn't you be? You would know that we are here with none other than Tracy Causey, which is clearly the man with a cause, talking about his journey to become the CEO of the Capital Area Health Network. Yes. So I know, okay, for those of you who are watching, you're not in Richmond, Virginia. Sorry, you live someplace else, but learn a little bit about the process of what's going on here. So I know when I drive through certain neighborhoods, I see the con locations. And so I actually had a conversation with someone just last week, and they were discussing getting dental services at con. And so I was thrown, I was like, that's not... Dental services in particular are hard to come by, extremely expensive. Yes. I am currently spending thousands of dollars on my mouth. And so I thought that was amazing because this particular person is on Medicaid. Mm-hmm. And so can you tell us a little bit more about the mission of Con, which you already gathered if you heard anything about his passion, about what led him to community hospital, but also can you tell us more about the services that you all offer?
Certainly. And so I'm very happy that you brought up the idea of dental, and that is a deep passion of myself because of all of the services outside of mental health. Dental is probably the least one that people can afford, and so it's very expensive, and not a lot of people have the resources to get access to dental services.
It seems to be a very low priority.
And it's, yes.
I mean, so like when I was looking through like government programs, assistance, even for your insurance, like I buy regular insurance, I can't get dental.
Yes.
And the option is like, I got geeky about it at one moment. And so the way that it works is that if you go in for dental care, they treat you the same way they do for my clients in Haiti. They'd rather pull your tooth rather than deal with it.
And unfortunately, that's what a lot of dentists do for the underserved communities of this country here. They, instead of trying to deal with it and make a treatment plan to restore or try to restore your tooth, they're like, well, you know what? It's so expensive. Let's just pull it.
That's what they do in third world countries, people. I'm trying to tell you, in Haiti, when they have dental services come, they're just there to pull teeth. Yeah. And so I was like, oh my God, it's like I live in a third world country. Okay, I'm back. Back to the other services.
Well, that's why we put in dental services in our locations, because we know it is expensive and we absorb a lot of that cost because we know how important dental services are to the self-esteem of a person. You know, being able to smile and not have gaps or missing teeth or rotting teeth. It is a very important part of life for people. It's your self-esteem. You know, it makes you feel better when you can have a healthy smile. So for us, providing dental services is a must. And yes, I take a loss on dental services, but at the end of the day, when we know that we can help somebody and be even healthier, it is something that we must do. The other services that we provide is primary health care. We provide mental health services also, and we provide health education. You know, we partner with other agencies in the community, and we bring services that you may not be familiar with or you really need, but you can't have access to because of the resources that you may not have. We pride ourselves in making sure that we are just as accessible as any other private practice, hospital system, or any other doctor's office that you walk into. And the look of our doctor's office is just as impressive. You know, some locations across the country may not look the part. I tell people all the time that you don't come into a clinic. My practices are not the old-fashioned definition of what a clinic is, serving the underserved, the low income people, and just looking like that. Mm-hmm. No. My practices are looking just as pristine as anybody else's practice, because when you walk through there, I want you to say, wow, I feel a little better because I'm in a good place.
I did say wow. In all honesty, I actually truly did say wow. So my PCP, who I get through. I don't want to drop names. It's through a standard regular program.
I understand.
But one of her locations is she's in at the location by 25th. She's over that side.
In East End?
Mm-hmm,
Okay,
yes, that con location. And so when I first decided, I wanted to go because I knew it was a community hospital. Mm-hmm. I knew it was for us and I should go. But I was really leery about it. I was like, I'll go one visit. And if I don't like it, I can switch back over here to the West End. And so I went in and I was just like, oh, this is nice.
That's right. That's absolutely right.
I was definitely a wow. So I don't say that lightly.
But this is what we try to make sure people understand, that our services are just as great as anybody else's service, and the expectation should be there. You know, as a patient, you should expect great services, quality care, and that's what we are providing. So that's what we are known for: healthcare for you in the communities that you live, work, and play.
So you mentioned the loss that you all have to take because of like dental services. And I know you all do you are truly known as a community hospital.
Yeah.
How are you offsetting that? Like, where's the money coming from?
Well, I'm glad that you asked that question, because we do receive some grants. And so the federal government does provide some resources for us to somewhat offset some of those losses. However, it's not enough. Mm-hmm. And so we are just now getting into fundraising.
Ooh, it's fundraising season.
It is fundraising season. And so when you guys see me coming, knocking and calling and asking, please don't hang up or close the door on me. Just say, come on in and listen to me, because I have a story to tell. I want to tell you the story about all the 14,000 plus patients that we serve every year annually. And we give them a home, a primary care home, a primary dental care home, a primary mental health home, a quality place for them to receive services. And so we are going to start fundraising in this season. This is the first time that we've done this. We're looking forward to raising money to renovate some of our property. We want to bring in specialty services, that's our next frontier. Right now, we're offering primary care, but what's happening is that we can do a pretty good job in primary care, but the next level of care, which is specialty services, it's already backed up. There are not enough specialists to go around for everybody. And so many times the patients have to wait a very long time. Well, my vision is that let's not make them wait. Let's go ahead and try to get those services under our umbrella and make sure that they can have access to those services right now.
So for the person out there who's listening, who's watching, and they're like, oh my God, you do amazing things. How can I contribute? Where can they go?
Oh, they can go to my website, which is www.cahealthnet.org.
cahealthnet.org.
Yes, and click the donate sign button.
Is it right at the top? It needs to be right. It needs to be big, it's right red, there. Right at the top. Donate.
I'm gonna make sure it's flashing. I want to make sure it's flashing. Okay.
So if they want to reach out to you, I don't know that you can reach out to Tracy. I know
this
seems very casual right now, but he is indeed the CEO. But if they want to reach out and find out more, the website is the best option. Do you all have a social media presence?
Yes, we have, and that is our social media, our website there, and you can click on our Facebook. We have Facebook, we have Instagram, but you can even call me directly. I'm not that busy. And I will answer the phone. Here's my direct phone number, 804-253-1968.
I'm going to make note of that because I didn't have that number either. Okay. Duly noted. Once again, Tracy, thank you so much for coming in and talking to us. We were honored to learn a little bit more about you and the passion that brought you here to our area. And thank you for the impact you're having in your new hometown.
Thank you very much for having me here. I appreciate it.
All right, people, we're going to head to a commercial break, but stay tuned because we have more financial news you can use.
Life can be a struggle. Find hope, healing, and answers at the Abundant Life Church of Christ, a place to encounter God through uplifting worship, singing, prayer, the preach word, and fellowship. One step can change your life. One step could shift your destiny. There has never been a better time to take that step than now. Come be our guest every Sunday at 10 a.m. at the Abundant Life Church of Christ, a place where you belong.
Listen, Attorney Alex Taylor is a soldier in a suit, defending anyone with criminal charges, DUIs, and more. Call Alex Taylor, your soldier in a suit, at 804-500-5000.
I'm Alex Taylor. Don't face your criminal charges alone. Put a former prosecutor with 30 years of experience on your side. Let me show you how a soldier fights for your freedom.
Call 804-500-5000 or go to alextaylorlaw.com.
Wouldn't it be convenient and safe to communicate with your dentist, pediatrician, medical doctor, or mental health professional anywhere you are without actually traveling to our medical centers?
Well, you can with a televisit at your local Capital Area Health Network. Call us at 780-0840 or go to cahealthnet.org. Find out how a televisit may be your best option. We are the Capital Area Health Network, the heart of the community.
And coming up next, we have financial news you can use from Lawrence Roberts.
Hello, everyone. I'm Lawrence Roberts with financial news you can use. Again, these are important things and tidbits that you can use. Well, there's been some news out there, some talk out there about life insurance, whole life, term, and people have even said whole life is a waste of money, a waste of time. Well, let's go ahead and tackle the elephant in the room, address the elephant in the room here, okay? All right. The best type of life insurance, hands down, for you to get is the one that's going to pay out when you need it. Now, unless you know exactly when you're going to die, or the Lord's going to call you, or however you're going to leave, or whatever you want to leave this earth, you might want to get something that's going to be there when you need it. But then again, it's not on you. Hey, you already passed. It's on whoever's going to bury you. You can donate your body parts to science. Well, science might not want your body parts. So, in situations like this, because we really don't know what's going to happen, how long you're going to be here, because we're all here for a purpose. We're all here for a time, and then our time is up. That's it. That's the reality of it. So, with all that being said, it really is no bad life insurance. It's bad companies, if you want to put it that way, a company that don't pay out. Now, if you ever get a life insurance policy that doesn't pay out, that's a problem. But you know what? You're not here to fuss at that company. Whoever you leave as beneficiaries, they're left with that headache. Term life insurance, just as the name says, is here for a period of time, a term, be it 10 years, 20 years, 15 years, or even 30 years. But understand this, only 1% of term policies actually pay out. Chances are, because you got the term because you're young, it's inexpensive, it fits in the budget, no extra costs. Let's be real. How the commercials go, you can spend $25 a month without even batting an eye. No problem. So, but whole life, it takes a little more thinking. You might take a little more budgeting and things like that. That's fine. But you also have to look at this here. What's in your budget? What can you afford? What's going to be here for the long haul? Well, if you plan on being here longer, up in your 80s, your 70s, maybe even the 90s, you might want to get something that's going to pay out. Oh, that thing of buy term and invest the difference. That sounds great. However, many people do not do that. And as you get older, that difference gets greater because the cost of life insurance costs more as you get older. So like I said, let's address that elephant in the room. Getting life insurance, you want to get it from a company that's reputable, a company that's been there and has a reputation and an ability to pay out when that time comes. I don't care if you get $1 million policy or a $100,000 policy. You want it to pay out to your family members. All right? Now, when you look at the different things, getting a term policy is fine, but you also want something that can be converted to a permanent policy. Because as we get older, I don't know about you, but I don't feel like running as fast as I used to when I was younger. I don't jump as high as I used to. My dunks on the basketball court are more in my dreams. So, with all that being said, oh, by the way, I do not weigh as much as I did in high school either. All that factors in the price of life insurance. So like I said, you want something that's convertible, something you can get, and you don't have to worry about going through that medical thing again, okay? Now, that is important because you want options, you want control. All these things are important. Come see me. I will help you choose the right policy because it's not about the policy, it's about the amount that's going to take care of your family so you're not worried about, hey, will my family have to move to a smaller apartment and all these other things? My kids won't be able to go to school and I plan for them to go to school, those different things. Again, I'm Lawrence Roberts with New York Life, and I look forward to talking to you, assisting you, and helping you find the right policy for you. You can reach me at 804-746-3714. Again, I'm Lawrence Roberts. Thank you.
Thank you, Lawrence, for those words of wisdom, of financial news you can use. But on that note, I still want to talk to you a little bit more about the numbers that represent you, right? So one, we know everything for you is identified by your Social Security number. And I laugh about it a bit because we bastardize everything. Your Social Security number is supposed to be used so that you can access your Social Security fund. That's all it was ever meant to do. All it was ever meant to be. That's it. But now it's used to identify everything about you. So much so that many states had to take it off your driver's license and give you, they call them tens. They had to give you specialized numbers so that they could stop using that number because it gave access to all your information. Then for your business, we have our EIN, the employer identification number. As it says in the name, it's supposed to be because you have employees. How they're supposed to know how much taxes you're paying, how you can be registered. That's all that number is for. But what do we use it for? It's how you apply for credit for your business. It's how you open a bank account for your business. Anytime anyone is asking for information about your business, they're asking for your EIN. But what about you? You are known by I said your social, we know that. We know for your business, your EIN, it's your credit score. Period. Do you know how many things, your life insurance amount, the type of policy you can get is determined by your credit score. Nothing about that seems logical. Nothing about that makes sense. What does your credit score have to do with your life insurance policy amount? Ever wondered why you can't get more than $10,000, $20,000, or the only time you can get a high amount is with term life? Have you ever wondered why? It really goes back to your credit score. So as we've mentioned before, that's part of the reasons why we are very vested in helping you all learn more about your credit, do more to fix and repair your credit, and learn more about what's involved in that number. So as I said before, one of the things that we're doing now is credit financial assistance and consultations. And the thing I don't think I've mentioned before is that we use AI, which, geek that I am, I find that very exciting. And so that's how the letters are formulated, how the attacks are generated. And here's a thing. I just want you all to know this one little thing because it tripped me out. Do you know that the credit bureaus are legally allowed to place back items on your credit report even though you have filed and had them removed? One more time for the road. Do you know that you can go through all the effort of writing the letters, doing the disputes, doing everything, and a credit company can remove it and then come back a few months later and put it back? And the why is because they're paid to house that information. Just one little tip. This is one of the reasons why you should be watching and reviewing your credit score every single month. Actually, look at mine every other day because it changes. Your credit score, it changes daily. All right. So that was just a credit tidbit for the day. And stay tuned because we have lots more of the WorkHARDaholic Show just for you. Like, share, subscribe, repeat. Like, share, subscribe, repeat. 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 Thanks for tuning in to WorkHARDaholics. Support our show by following on YouTube and all major social media platforms at WorkHARDaholic. Until next week, happy entrepreneuring.